Okay, Ms. Jones, as you're ready. So Courtney outside took your vital signs. Your heart rate was great at 68. Your respiratory rate is 12, and your oxygen saturation is 99% at room air, which is just where we want it. So now I'm just going to take your blood pressure to verify it. Okay. Perfect, 118 over 68. All right, so have you had a full head to toe exam before?
Yeah, with my previous physicals.
Okay, so like I said, just real thorough. We just want to look over everything so we don't miss anything and get a good baseline, okay? So like it says, just start head to toe, okay? All right, so first just going to look through your hair. Just making sure there's no lesions on the scalp. Texture of your hair looks good, no infestations. Everything looks good. In the meantime, I'm just looking at your skin. Like you said, there's no rashes, no redness, no swelling. There's no moles that look that we need to be concerned about. And while I'm here, I'm going to look at your fingers. There's no clubbing. You have good capillary refill, so everything looks good there. All right. Now just look straight at me. I'm just looking at your head. It's normocephalic. There's no lesions, no swelling, no redness anywhere. Everything looks good. I'm going to check for TMJ, so I'm just going to place my fingers right here. What I want you to do is just open and close your mouth for me. Good. One more. Okay, so there's no clicking. I feel no crepitus. Everything's midline. There's no deviation in your jaw, so all of that looks good. All right, now I'm just looking at your eyes. Nice eyebrows and eyelashes. Your conjunctiva is pink and your sclera is white. Everything looks very good. I do want to check your vision. So if you could just hold this about 14 inches away from your face and cover one eye for me, and then read the lowest line possible.
P, E, Z, O, L, C, F, T, B.
Okay, great. Now cover the other eye. Maybe just a little bit closer.
P, E, Z, O, L, C, F, T, B.
Okay, now what about both eyes? And try and read the lowest line backwards.
D, T, F, C, L, O, Z, E, P.
Good. Thank you. So I'm just going to go dim the lights. I want to check your pupillary reflex. Okay. Look straight at me. Good. So they're symmetrical. Your eyes, pupils dilate with the light, which is what we're looking for. There's no excessive tearing or anything like that. No exudates in the eye, so that's great. Okay. So now I'm just going to check your 6 fields, cardinal fields. So I want you to follow my finger, but keep your head straight, looking at me. Okay. Okay. So I'm just looking for any extraocular movements, any kind of fluttering of the eye, which we call nystagmus. And now convergence, I'm just checking for, so follow my finger in. Perfect, good job. Okay. So now I'm just gonna look through your ears, everything looks symmetrical. Again, there's no swelling, no redness, anything like that. Okay. I'm just going to push here. Do you have any pain, any tenderness?
No.
Okay, and then down here in master process, any tenderness or pain? No. Just going to look inside your ear. Great. So auditory canal is clear. Your tympanic membrane, which is your eardrum, is pink and intact. There's no extra swelling, no drainage. And now I just want to check your hearing. So I'm going to whisper something behind your ear. You're just going to repeat what I said, okay?
1618.
Good.
4173.
Perfect. Okay, let's get another one of these. And then here, I'm just going to look in your nose. Okay, everything is midline. There's no deviation. Again, no lesions, anything like that. Okay. All right, I just want to have you smile for me. Good. Now open your mouth. Good. Your mucous membranes are moist. Your uvula is midline. Everything is pink. There's no redness or swelling. I don't see any gingivitis or white patches. You say "ah" for me. Real big "ah." Good. All right. Then I can see the soft palate rise. That's perfect. All right. I'm just going to check your sinuses. Right here. You know, do you have any pain or tenderness?
No.
Good. How about here? Any pain or tenderness?
No.
Good. Good. All right. And then I'm also going to check your lymph nodes. So, pre-auricular, post-auricular, occipital, tonsillar, submandibular, segmental. Okay. Superficial cervical, posterior cervical, deep cervical, and supraclavicular. Good. So that looks really good. All right. So now I just want to look at your neck. Everything looks symmetrical. I want to check your range of motion. So turn your head side to side, and then one ear to one shoulder, down, and then back and forth. Good. All right. Now I'm just looking at your trachea. Go ahead and swallow for me. Good. Everything's midline. Now I'm just going to go behind you. I want to check your thyroid. Okay, swallow again for me. All right. While I'm back here, I'm going to check your posterior lung. So I'm just going to have you turn just a little bit. Good. Okay. Perfect. So I'm just feeling everything. I'm going to undo your gown a little bit. Good. Again, all your skin looks good. No lesions, no redness. I'm just going to do some percussion on your lung fields. So this just allows me to kind of feel what I should be hearing underneath, whether it's fluid-filled, solid, things like that for the air fields. Go ahead and listen to your lungs. Just take nice deep breaths with your mouth open for me. Okay, check for CVA tenderness. Does that feel painful or any tenderness there?
No.
How about there?
No.
Good. Alright. Take a nice big deep breath for me. Good. Just checking your lung expansion. Great lung expansion there. Tighten back up. Okay, I'm going to have you lay down for me, so I can go ahead and do the front side. So again, I'm going to bring your gown down a bit. Just feeling no pain or tenderness, anything. Just do some percussion again. Light again. So I'm just going to be checking for JDD here with some tangential lighting and looking at the vessels in your neck. And then I'm going to bring this blanket up so I can get to your abdomen. I'm going to lift your down up, okay? Alright, so here I'm just going to use tangential lighting too, so you can see the PMI. I just want to feel for your carotid arteries here. You have very nice, strong pulses. Good. And then we'll go ahead and listen to your heart sounds. Perfect. Let me go back through one more time with the bell. Okay, you have a nice, strong heartbeat. So I hear S1, S2, which are the sounds that they're looking for. I don't hear any extra sounds or any murmurs. And everything just sounds really good. Your heartbeat is nice and regular. Okay. I'm just going to check the rest of your pulses. I'm going to check your brachial pulse. You can just rest your arm down. Okay, your pulses are strong and equal. Fantastic. I'm going to lift this up and feel underneath your legs. Popliteal pulse, and then your dorsalis pedis. And you have great, great pulses. Okay, so now, like we discussed in the interview, you said you don't really do your self-breast exams. So we're going to talk a little bit about that. I really want you to start doing that at least once every month. So when you do it at home, what I want you to do is just stand in front of the mirror. And you're going to do it starting with your hands down. And then you're going to raise your arms all the way above your head. And then put your hands on your hips. And lean a little bit forward. And in each position, I just want you to look at your breasts and see if there's any difference in the symmetry, if you have any nipple discharge, if the skin seems to be dimpling or rippling, anything like that, and then obviously any visible lumps. So that's what you're looking for. And then you're going to lay down like you are, and you're going to raise one arm above your head, and with your other arm, you're going to feel this breast. You can do it in a pattern so that you don't miss any area. So either in a circular motion, so start in the center and work your way out like a spiral, or zigzag up and down. But just make sure you get all the way up, even into your collarbone, and all the way up into your armpit here too, and just go all the way around. Okay? All right, you can put your arm down. Okay, and then get your abdomen. I'm just looking at the contour and everything, the lumps, anything that I see. Again, the skin looks nice and smooth. And go ahead and listen for your belly sounds. Good. Alright. Some compression again. Alright, I'm just going to do some light palpation. I'm going to go a little bit deeper. Just allows me to feel for different things. And I'm going to do some deep palpation, okay? Check to see if I can feel your liver. So take a nice deep breath for me. you said no joint pain, anything like that. I just want to check everything. No swelling, no tenderness. Good. Full range of motion, everything. Great. All right, you can go ahead and have you sit back up for me.
Just covering the bottom of this.
Yep. Okay. Okay, you're covered. Sit back down for me. Is that too high for you? All right. Just want to test your strength. So put your arms out like this. I just want you to resist against my pull, okay? Good. And now push. Good. And same thing with your legs. Pull in. Push out. Perfect. All right. Now I just want to check your reflexes. All right. So this one, it's your brachioradialis. I just want you to rest your hand in your lap just like that. Just want to see your muscle twitch here. Oh, that was a good one. All right, same thing in this arm. Teller. Try and scoot back on the bed for me just a little bit and let your legs move. There you go. That was a real good one. Oh, you have really good ones. Your Achilles here. Good. Perfect. All right. Okay. Now, with your eyes closed, I have a cotton swab here, and I'm going to touch you different places of your body. I just want you to tell me where I'm touching you, okay? Go ahead and close your eyes.
My left foot. My right hand. And I'll touch you. My nose. My left ear. And my right leg.
Okay. And now I'm either going to touch you with the soft end or the sharp end. I want you to tell me if you feel like it's dull or sharp. Okay? Close your eyes.
Dull.
Sharp. Sharp. Sharp.
Dull. Soft. Sharp. Soft.
Great. All right, Ms. Jones, last thing I'm going to have you stand up for me. Okay, so facing me, I want you to put your feet together. And I want you to hold your hands out with your arms up. And close your eyes, and we're just going to check your balance. I'm right here to catch you in case you feel like you're going to fall. Okay, perfect. All right, so now what I want you to do, I just want to look at your gait. So I just want you to walk to that curtain and walk back to me. Perfect. Okay, now I want you to do it again, but this time go heel to toe. Perfect. All right, Ms. Jones, that was fantastic.
All right, thank
Do you
you.
have any questions for me?
No, thank you.
Okay, thank you.